So I'm here primarily representing the Winnisimmet Regional Opioid Collaborative, which is the collaboration between Chelsea, Revere, Saugus, and Winthrop. And again, the city of Revere received this MOAPC grant from the Department of Public Health. MOAPC stands for Massachusetts Opioid Abuse Prevention Collaborative. And then we wanted to name ourselves so that we had our own, identity besides that. And we were charged by the state to complete an assessment, specifically about opioid misuse, abuse, and overdose. And then also the other purpose that the Department of Public Health has enforced in us strongly is that we want to really build the capacity within the communities and mobilize folks to help address the issue. And just so everybody's on the same page, when we talk about opioids, we're talking about, that's a general term that includes natural opiates that are derived from the opium plant, so from poppy plants. And it also includes semi-synthetic opioids, and then opioids manufactured in prescription drugs such as Percocet, Oxycontin, Valium, Vicodin. Not Valium,
Yeah.
Sorry, Vicodin. and of course heroin. And here's just a list of some of the most commonly used opioids. And again, just so that we're all on the same page, the ultimate consequence of using opioids is overdose and death caused by the overdose, and the Department of Public Health was seeing those dramatic trends, which I can show in a minute, of the number of deaths that are caused by those. So that's why they were motivated to address that issue in particular. And of course there are other consequences, similar to other substance use. There are other social, economic, and health problems that are associated with substance use, and some of those factors that drive the problem and make the problem worse. And that another point we wanted to make was just that anyone who misuses opioids, and misuse, I'm getting at using prescription medication, prescription opioids in an inappropriate manner, not as prescribed, for an actual illness. So that can make someone at risk for overdose. So this is just Pat already started to bring up some of these major headlines that we've been seeing lately. Opioid overdose in Eastern Mass, highest in nation. The opiate trap, as heroin use spreads, cities and families battle its devastating effects. And of course, with the death of Philip Seymour Hoffman, I think it's just brought a lot of attention to the issue. And fairly recently, the mayor of Boston has brought to the table getting Narcan in the hands of all Boston first responders. Narcan, so everyone's on the same page too, is a medication that can reverse those effects of the opioids and bring somebody out of that and reverse the effects of the opioids. So here's some of that opioid-related overdose deaths data, and you can see here pretty clearly that trend over time since 1990 has been on a dramatic increase. And in 2010, there were 555 deaths that they could clearly associate with opioids, and that represents about 2/3 of the poisoning deaths that happened in 2010. So just showing that a lot of the deaths those poisonings were so correlated with opioids. So Pat asked me to relate this specific assessment on opioids to the larger community health assessment that I'm sure you've been hearing about. And my colleague Leslie Aldrich led that initiative with many of you here. So this is just a little bit of a preview of some of the data, and I bring it to you because one of the main findings was that that substance use, broader than opioid use, was one of the main messages and outcomes of that work. So Leslie helped develop a quality of life survey, and this is just some detail about who responded to it. It was a survey that went out to through many of your networks, and it asked community members what they think about several different factors. There was lists of many different health conditions, and they were asked to check off which were the primary concerns to them. And we also did this same quality of life survey as in a community health assessment in Chelsea, Charlestown, and Revere, and on the survey we asked about all these different health factors, and in all of these, substance use was one of the top concerns. So this just shows that in Winthrop, according to the quality of life survey, 57% of folks noted substance use as a major concern. Charlestown, it was 75%, Chelsea 61%, Revere 62%. So here's a little bit more data that was pulled from the community health assessment, and a little bit more of the data collected from the quality of life survey. I'm sorry, there's a lot going on in this slide. So the top left column with the arrows, that is mostly all the Winthrop Health Survey, Youth Health Survey that's conducted. It's based off of, I believe, the Massachusetts Youth Risk Behavior Survey. So these are some data from the high school students who completed it in 2009, I believe, is the most recent year. I'm sorry, 2011. 2011, and the Massachusetts, we have some statistics from Massachusetts, 2011 too, or 2009. Okay, so some of the high school youth reported 30.5% reported riding with someone who had been drinking. 32% of Winthrop High School students reported current marijuana use. 37% reported current binge drinking. Current use is they reported using in the past 30 days, and I believe binge drinking is 5 or more drinks in one setting, I think is how the survey question is phrased. But contrary to that, current alcohol use reported by the students decreased from the previous year. So that might be some sign that prevention efforts amongst that in that area have improved. And used heroin in their lifetime. So the survey also asked about whether or not you've used heroin, and 5% of students did report that. And it was 2% in Massachusetts in 2009. And those are similar numbers to certainly Revere and Chelsea, I believe. Certainly Revere has some of those similar self-reports. So again, that's the youth saying, according to this anonymous survey, that they've engaged in some of these substance use behaviors. So on the bottom corner is a little bit of a little scale there. So also on this quality of life survey, which went out to adults in the community, people rated on a scale from 1 to 5 how much of a problem is drug and alcohol abuse in Winthrop, and the average rating was 4.2 out of 5. So I think that speaks pretty clearly to the respondents reporting that is a top concern of theirs. The quality of life survey also asked about whether or not their family has been affected by alcoholism, and 32% reported such. So I'm going to talk about the overdose deaths in a minute. The bottom right chart, so that is substance abuse treatment admissions, the crude rates by primary substance from 2011. So this is Department of Public Health data. So this is data of how frequently people are accessing treatment where the primary substance is heroin, alcohol, cocaine, marijuana, or other. So 43% of all admissions in Winthrop were related to heroin use, I believe. So folks coming in saying that that's what they most need treatment for. And so it does look like it's higher than Massachusetts. So it's hard to like really interpret what the treatment data mean. I mean, I think the point is that, you know, there are folks who are suffering with it, but they are accessing treatment. But we don't know how many folks there are that are not. So in any event, compared to the state, it looks like that is a concern among some folks here. Does that make sense? I don't know if I should take questions now. We can follow up questions afterwards. Okay, so here's a little bit more about the specific opiate problem. The left side are the deaths data, similar to that data before, where death certificate data were analyzed and trying to pinpoint how many deaths we could attribute specifically to opioids. So according to this analysis, there were 12 deaths from 2008 to 2010. And I think what we wanted to highlight here are some of the demographics of those folks, that they seem to be 100% white. There may be a little error there, but nearly all of them were white, and that the age group was 45 to 64 were kind of the most frequent age group affected who were dying from opioid overdoses. And most were male, 58%. And on the right side, these are non-fatal opioid overdoses. So we know this data come from hospital discharge data, so folks who were treated for an opioid overdose from Winthrop. And there were 240 between the years of 2007 to 2009. And again, we were looking at this mostly so we could see who is it that's suffering the overdoses. So it looks to me that it is a broad range, about 25 to 64. That's the larger pieces of the pie. I think there are some folks younger who are experiencing overdoses. And again, this says 45% male, so there are some women affected by the problem too. So this was some of the data that really, again, drove the Department of Public Health to address opioid overdose across the state. Okay, so here again are the opioid-related overdose deaths, and we were trying to look at how those stand out when we look at the population of these towns in our region. So Revere still was the highest once we kind of considered the population per 100,000. But you can see that Winthrop and Saugus are not far behind. And again, these are a little bit old. I mean, I think what we're hearing from the community is that the number of deaths and the number of overdoses are greater in the more recent years, but this is kind of the most current hard data, public health data that we have. So we did the same thing, trying to control for the population of the communities to get a sense at how much of a problem it is. And these are those non-fatal overdoses. And this was fiscal year 2009, so a little bit older amongst our collaborative, our communities in our collaborative. So it's certainly a problem in the region. Here's a little bit more of that treatment rates. I think this might have been the same data or similar data to that earlier slide. but it just shows that folks from Winthrop are accessing treatment for heroin or heroin-injected drug use or other substances at a greater rate than the state. This is from 2011. So here we also, again, wanted to focus in on any youth self-reported use, because we know that often that begins, some experimenting often begins at those ages. And we have the Winthrop 2009 and Winthrop 2011 compared to the Mass, which is the lighter color bar on the right. So we have ever drank alcohol, ever smoked cigarettes, and ever used marijuana, and ever used prescription drugs. So that includes non-opioids, but still you can see that there is some reported use in Winthrop, among Winthrop high school students. Less than the state, but it could be on the rise, 6% in 2011, or 2009, and then 11% in 2011. So it may be an increase in number of youth using or experimenting. So, and again, ever using prescription drugs, I believe the survey question clarifies they're using it to get high or without the directive of a provider, physician. So now I wanted to tell you about some of this new local qualitative data that we collected to really dive deeper into the opioid problem. So we did that through conducting interviews and focus groups, and the work group here really dug in and did outreach and conducted these interviews and focus groups for us. We did 17 interviews and 8 focus groups. We also had included in there were some folks that were familiar with, again, the region, so folks from North Suffolk Mental Health or other providers, that serve the region. So we do want to kind of understand what's happening, any problem specific or to Winthrop, because that can help us determine our strategies, but we did have perspectives of, the region included in this. So we did hear from active opioid users, family and friends, the business community, first responders, law enforcement, recovery community, senior citizens, veterans, and some youth. And I believe we have a little bit more data that we're going to incorporate it in here. So the point is that we really tried to reach out to the folks that are most affected by the problem, or who most see what's going on, who have a pulse of the community. So we hope that gives some balance and validity to this information. So through these interviews and focus groups, there were 3 kind of main questions that we were asking, and those were, how would you describe the problem, and then who do you think is most affected by the problem, since that can help us target our interventions, and then what do you think is driving the problem. So that's what I'm going to show you here. So this is a word cloud. You've probably seen them before. It's just kind of a fun way to show some of the main keywords or themes that folks expressed when we asked them this question. So heroin use, community, epidemic, we heard that a lot. So people in the community do perceive that it's a problem, or at least all the folks that we talked to. Then we wanted to get a sense, again, comparing to, or to supplement that other data about the overdose deaths and the overdoses, of descriptions of who is affected by the problem. We asked folks, what were they seeing, these folks who are out working with individuals, and that it is happen amongst, white and men, 20s, 30s, some females. So we also asked, what do you think is driving the problem? I'm sorry there's a lot on this slide, but I wanted you to see them all together. And so these were some of the top themes that came up from all this Winthrop data. These are the same as what's coming up in the Revere, Saugus, and Chelsea's data. So these are all common reasons or factors that we think are making causing the problem, making it worse, and they include causes of overdose and use, but also causes of that initiation of use. So it's kind of all of it together. But we were hearing from folks a lot about it's easy to obtain heroin and pills. It's in the medicine cabinets. We were hearing a lot about underlying personal issues or kind of mental health issues that might drive someone to use substances. Loneliness, low self-esteem, life stressors, and depression. And we really did hear this pretty clearly that often people are using to cope with their problems or escape from their problems, using opioids in particular. We also heard a theme about related to poverty and unemployment, that people are out of work and they may cope, similar to above, with using drugs. That's kind of that speaks to some factors that are related to health in general, what we define the broad definition of health, the socioeconomic factors that relate to health sometimes. We heard that acceptability, that there are some community norms, or that it's okay to use drugs, that we heard that some prescribing practices were the cause, that there seemed to be, some providers prescribing painkillers too often or in large quantities. So I know across the state and the nation there's been a lot of work about that, about training for providers or physicians in pain prevention. So maybe that's something that could be emphasized through this grant, training through the grant for that. And then there's also the perception that prescription drugs are not harmful, and that I think the notion that what is in Percocet, that fundamentally, chemically, that is the same as heroin, and that you can overdose on those if you take too much. So that could be an education around our knowledge of the community at large. We also heard a lot of feedback around lack of parental involvement or supervision. In this kind of relates to the economic factors, that sometimes everybody, both the two-parent families are both working multiple jobs, and the kids are left alone unsupervised. And I think that's correlated with, or that's a known factor in terms of prevention work, that if you engage youth, they're less likely to engage in risk behaviors. And then stigma. So particularly around opioids, there's a lot of shame and guilt that family members feel towards a loved one who is using these substances, and that can be a barrier to accessing care and accessing support. And that can keep people from getting help themselves or help for their loved ones. And then we also did hear a little bit from folks in recovery that there is a feeling in the community that there's apathy towards individuals who suffer from addiction, and that nobody cares about them. So again, these are factors that we're seeing in the whole region, and it's certainly not only here that we're hearing that. Okay, so just to summarize a little bit, trying to put all that quantitative data together with this new data that we we collected, that it seems like this is a problem locally, regionally, nationally. It is perceived as a problem in the community, you know, particularly opioids, and that there are some demographics of folks that are most affected by the problem. So for the purposes of this this grant, we really want to get your feedback on particularly these main factors that we think are driving the problem in the community. So we'd like to break down into groups and kind of consider these, and also hear from you whether or not you agree that these are the primary ones, and whether or not there are any other risk factors or other things that you think are contributing to the problem. And then we'd really like to hear from you too, which of these, if there are any, are kind of the primary ones that could help us guide us in directing where our strategies should address.